Hi, I'm really excited to be sharing a series of videos all on mental health within the workplace. I'm here with my beautiful panel. I've got Chhaya here and Zobia. We want to just introduce ourselves first and we talk about our mental health experience and then kind of go from there.
So I'm Zobia. I'm a psychiatrist. So my experience with mental health consists of sort of having to deal with it on a daily basis through my work.
I'm Chhaya, I'm a dentist, and I've recently had a baby as well. So I guess it's sort of the stress of working in dentistry, the day-to-day stresses of working with the NHS, and added on top of that, having a baby as well, which plucks you out of your dental life into a different mode.
And my name's Maruk. I'm the founder of the group, and I went through a divorce a couple of years ago, and that was quite a difficult time. I felt quite low, and also I was going through just quite a series of different emotions, and really struggling sometimes to really concentrate at work. I found that, well, in terms of psychology, it would be like going through the stages of grief. So it was literally a roller coaster, and I was really lucky to find my therapist and find a lot of healing power in kind of working on myself and exploring lots of different issues that really helped me kind of come out of the depression. So I was really kind of lucky with that, and I really see the value of therapy.
So yeah, I was going to talk a bit more about how, as we've said, I think mental health is on a spectrum. I think all of us are affected. All of us have mental health in some way. All of us are affected by mental health problems in some way. It is just a spectrum, and it depends on, situations in your life, various triggers, various stresses, things like being at work, having a baby, which tilt you into that realm where you might be, in the position of getting a diagnosis of something, but actually the difference is really arbitrary because all of us have that mental health that we have to look after, and all of us are just a few sort of life steps away from gaining a diagnosis, and that's why it's so important that we are all honest and open about our experiences, and we're all really willing to talk about these things and the stresses that we have, and try and work through them a little bit, so that it isn't that stigmatized thing of, oh, okay, now I'm going to go somewhere to receive a diagnosis and then I'll be on whatever medications and treatment pathway. And it's just something that all of us have and can talk about.
Yeah, and definitely in dentistry, you kind of need to be perceived to be perfect. You need to do the perfect treatment plans and see all your patients, and you don't want your patients to know that you've got mental health issues, or if you've got any issues at all, if you've got a bad back or anything like that. So really it's nice to have a safe space to speak about your problems.
Yeah, I think that's really, really important, and it's something that it would be good to kind of explore and help GDPs and professionals and women working in business, and just, I guess, generally the public feel more empowered to speak openly, and really own their mental health and kind of help each other with their journey.
That's exactly it. I think we've got a long way to go in terms of our professional bodies, our regulatory bodies, recognizing that this does exist, and actually people should feel open enough to talk about it without being stigmatized by our own workplaces, without it having to be that problem where that person's been labeled and they're going to see occupational health, and do people know about it, and everything else. It should just be something that's integrated into our workplace. So I was in places that I've worked before, perhaps because we're psychiatry trainees, we do get sessions sort of every hour where we sit down with someone, usually a qualified psychotherapist. It's called a Barlin group, and you kind of discuss cases and things that have affected you during the week, and everyone can sort of listen and share their own reflections on how it's affected them. I think something like that is so important to have, not only for dentists, pretty much it's applicable to every professional body, really, isn't it? Because everyone needs to have that outlet. I think you were saying before that you found therapy really, really useful. And it is because you have a safe place to talk through things.
Yeah.
And certainly when you have a baby, there's always lots of checkpoints, and the health visitors come in and they ask you how you're feeling. When you go to your GP, they ask you that you fill in a form to see really, how far up the mental health you are. So it'd be nice to have something like that supported by the GDC in the workplace, because certainly dentistry can be just as stressful as that, really.
Yeah, definitely. I wanted to also discuss about the work-life stresses that we have as a dentist and as a medic and just generally in business. The one thing probably that's most stressful is the concern that maybe I might get a complaint, and although despite I'm doing the best that I can and in the best interest of the patient, they might not view it that way, and that's always stressful because we're working kind of in a way. The back ends with us, so there's a lot of responsibility.
Yeah, and the stresses with that come also because you just don't think it's fair. You're trying to do the best that you can in the limited time that you have, and sometimes a new patient comes in and they've got a long list of problems and you've only got 10 minutes, and there's only so much you can do, and that can end up with the patient being unhappy, with you being unhappy, because you want to provide a good service.
Yeah,
and that's
the way.
Exactly.
Yeah, you want to do as much as you can.
Yeah.
I know I was speaking about the group that I was talking about. As I said, it's been implemented in places like where you can have an external person come in to something like a neonatal intensive care unit and speak to the pediatricians there. Again, really busy job, lots of stresses, fear of things like litigation. The NHS isn't the same place as it was sort of 25 years ago. And it just does become increasingly more stressful. Add to that all of the problems that people have on, just in their day-to-day lives, and all of the additional stresses like having a baby, but you're still working, you're still you're still going to go into that professional life, and something like those groups, seeking support from having a support network is really, really important, I think, to be able to work through those issues.
So really it'd be nice if there was a nice pathway, or if there's some sort of way in which we can discuss these things and get it off our chest, really.
Yeah, I think that would be really beneficial. I also found mindfulness really, really helpful, and it was something I definitely got into during that period of my life. I hadn't explored it before, but it was quite life-changing, and I found just being outside in nature really healing. Doing exercise and just kind of exploring being present just helped me feel a lot more connected and calmer and happier.
So I think it'd be nice to know where to go, really, if there's any sites or if there's anything like that where you can go if you are feeling that a bit stressed, or you feel like your things are getting on top of you.
So the first port of call is always you can always go to your GP, and they should have network set up to guide you to, depending on what you need. Again, people always think with mental health problems it's not something where you're always going to go and then always going to end up on antidepressants or whatever. You talk through your issues, and whatever's suitable to you, you're the patient, you have the biggest say in what happens after that. There's various organizations. Sometimes they do have long waits. You can access things like psychotherapy, CBT, which I think is you did, which you can access through various websites. You just have to Google BPS, which is the British Psychotherapeutic Society, and you can find a therapist through there as well.
Excellent.
That sounds good. Thank you.
Thank you.